Hi there and welcome. My name is Dr. Marlena Jabara, and I'm the proud founder of RadPodSquad. The RadPodSquad Fellowship offers an immersive learning experience tailored specifically to podiatric imaging. RadPodSquad combines comprehensive curricula, cutting-edge techniques, and on-demand access to training that will provide you with the new knowledge and skills that you need to boost your confidence in imaging and truly make a difference in treating your patients. Check us out today, radpodsquad.com. Let's move to the medial side. Now, looking at this illustration, we can appreciate the medial malleolus with the super strong medial flexor retinaculum, which is restricting all of the contents of the tarsal tunnel. So all of these structures here are in the tarsal tunnel. That's your posterior tibial, flexor digitorum, flexor hallucis, and the nerve, artery, and vein bundle between them. Looking at this illustration, we can appreciate the tendon sheaths are covered by this gliding bursae that help it to move deep to the flexor retinaculum. And of course, we can appreciate the tibialis posterior being the most superficial, attaching to the region of the medial navicula. We can appreciate the flexor retinaculum draped over, and of course, even the Achilles tendon posteriorly. And on the medial side, what you're seeing is a portion of the plantaris. Looking at the posterior tibial tendon as it comes along the posterior deep aspect of the leg compartment, moving towards the medial retromalleolar groove, we get a dorsal look at the tendon as a portion attaches to the medial navicular, and then the lateral bands attach to the cuneiforms and the metatarsal bases. So this shows you the importance of its support along the medial plantar arch, the talar head being superficial to this region. Moving on to the deltoid complex, we can appreciate right away the superficial band shown here. This is your medial malleolus. We have your tibio-navicula, we have your tibio-spring, and you have your tibio-calcaneal portions of your superficial deltoid. All of these guys are going to go on to attach to the supromedial band of the spring ligament, and that forms the floor of this region. Representative coronal images through the deep deltoid demonstrating the posterior tibio-talar ligament. These are the thin hypointense bands of a normal ligament. You can see on the T1 weighted image the fat decussating throughout the normal ligament. We can appreciate the posterior tibial and the flexor digitorum, and these ligaments are deep to the region of the medial flexor tendons. Moving on to the spring ligament, when the superficial tibiospring reaches the medial aspect of the talar head, we can appreciate the supromedial band of the spring ligament, the medial plantar band, and the inferior band. This is the region of the supromedial band of the spring ligament, which will then move down to form the medial plantar and inferior plantar bands. Are you ready to take your podiatric imaging skills to new heights? Check us out at radpodsquad.com. Explore our online learning community. And don't forget to like and subscribe to our YouTube channel for more enriching content.